Whereas the right to contraception is a fundamental right, central to a person's privacy, health, well-being, liberty, dignity, equality, and ability to participate in social and economic life. And
whereas the United States Supreme Court has repeatedly recognized the constitutional right to contraception. In Griswold versus Connecticut, the Supreme Court first recognized the constitutional right for married people to use contraceptives. In Eisenstadt v. Baird, the Supreme Court confirmed the constitutional right of all people to legally access contraceptives, regardless of marital status.
Whereas the right to contraception has been repeatedly recognized internationally as a human right. The United Nations Population Fund has published several reports outlining family planning as a basic human right that advances individual health, economic empowerment, and equality. Access to contraception is internationally recognized by the World Health Organization as advancing other human rights, such as the right to life, liberty, expression, health, work, and education. And
whereas contraception is safe, essential health care, and access to contraceptive products and services is central to a person's ability to participate equally in economic and social life in the state, the United States, and internationally. And
whereas contraception is key to sexual and reproductive health, contraception is critical to preventing unintended pregnancies, and many contraceptives are highly effective in preventing and treating a wide array of severe medical conditions and decreasing the risk of certain cancers. And
whereas family planning improves health outcomes for women, their families, and their community, and reduces rates of maternal and infant mortality and morbidity. And
whereas the United States has a long history of reproductive coercion, including childbearing forced upon enslaved women, and the forced sterilization of Black, Puerto Rican, Indigenous, immigrant, and disabled women, reproductive coercion continues to occur. And
whereas the right to make decisions about contraceptive use is important for all citizens and is especially critical for historically marginalized groups, including Black, Indigenous, and other people of color, immigrants, LGBTQ2S people, people with disabilities, people with low incomes, and people living in rural and underserved areas. And
whereas state and federal policies governing the pharmaceutical and insurance industries affect the accessibility of contraceptives and the settings in which contraception services are delivered. And
whereas despite the clearly established constitutional right to contraception, access to contraceptives, including emergency contraceptives and long-acting reversible contraceptives, has been obstructed across the country by the federal government and state governments.
Now therefore be it resolved by the House of Representatives of the 98th Legislature of the State of South Dakota, the Senate concurring therein, that the right to contraception be recognized, and access to contraception and information related to contraception be protected for all adults regardless of actual or perceived race, ethnicity, sex, income, disability, national origin, immigration status, or geography.